I'm Dr. Ron Allen, Medical Director and Surgeon at Lasik Plus in Brookfield. I want to thank you for selecting our center for your preoperative evaluation. I do want to share some information with you before you arrive for your appointment. First, as to me, I'm a lifelong Wisconsin resident. I performed tens of thousands of LASIK procedures and over 50,000 refractive surgical procedures. You're in good hands. As to Lasik Plus, it was founded in 1995, and we now have centers throughout the United States. As to our Brookfield location, it opened in 2005, and we still have original members of the team. As to the kind of laser that we perform here, we only do all laser LASIK. And we use the two leading excimer laser platforms. So we have amazing technology. We have a long history of outstanding clinical outcomes, and we have very high patient satisfaction. One feature our patients love is we have guaranteed financing. So we use a number of different programs, but we do guarantee financing. In addition, we have multiple pricing options so that we can make LASIK affordable for just about everybody. And one of our programs offers lifetime enhancement guarantees. So if you would need retreatment years from now, that's certainly going to be covered. In addition, we have an experienced, warm, friendly staff. So we have pretty much everything you could want in a LASIK provider. Yet, some patients, they'll schedule their LASIK evaluation appointment and then cancel. So they're obviously interested in pursuing the LASIK dream, but at the last minute, something has caused them to reconsider. So I want to address some of those concerns. I think one issue is this worth your time? Everybody is very, very busy. Do you really need to take an hour or two out of your time to come in for a LASIK evaluation? And I think it's an extremely valuable experience. First, you're going to receive a comprehensive evaluation and find out if your eyes are healthy. You'll receive specialized testing for LASIK. And to find out if you're a candidate, you're going to meet Dr. Mackel, our experienced optometrist, and our warm and friendly staff. That alone is going to take some of the anxiety about LASIK. But you're going to learn specifically whether you're a good candidate, what technology is best for you, and you're going to have all of your questions answered. I think a second concern is this going to be a hard sell? I mean, everybody hates that. It doesn't matter what situation is, but no one likes being forced to commit something that they're not ready to do. There's some patients that have been thinking about LASIK for a long time. They've researched it. They've had friends and family have it done. And their big concern when they come in for the evaluation is, can they have the procedure today? And so they're ready to go. But we also know there's a lot of patients that are much earlier in the investigation process. So they're not ready to commit yet. And the last thing they want is to feel pressured. So I can guarantee you're not going to feel pressured. Our staff is very nice and they're understanding. Now, if you show some interest, they're certainly going to offer you appointment slots that are available. But this is not going to be a stressful situation. It's going to be a good experience for you. And that brings us to the third issue, which I think is really the big issue for most people, and that's just fear. It's natural for most of us not to want to voice it. But I think with any procedure that's going to be done to us, there's some anxiety, and I think it's more so when we're talking about our eyes. Now, one thing to remember is there's a number of peer-reviewed studies that have shown that LASIK and contact lens wear have an equal safety record. So LASIK is not riskier than long-term contact lens wear. I think another big thing is that most patients have a misconception that to go through the procedure would require them to do some complex movements and they better be absolutely perfect or there'll be a problem. And that's simply not the case. The procedure is only going to take about 10 minutes and it's usually painless. It's pretty much the lasers and eye fix your eyes, and your job is just to try to remain still, try not to squeeze your eyes. And when I ask you to look at the little flashing light, I'm certainly going to give you a prescription for Valium to help you relax a little bit. But the procedure itself is in two parts, and you're going to learn more about that when you come in for your evaluation. But the first part is creating a flap. And with all laser LASIK, we do that by creating a very precise bubble layer. And you heard that right. We make your flap by creating a bubble layer. If you were to move significantly and it interrupted the bubble pattern creation, all that happens is we're just simply going to put in another bubble layer. The second part of the procedure is where we sculpt the cornea with an excimer laser and get rid of your glasses prescription. And I'm going to ask you to look at a little flashing light, but that's not what's guiding the treatment. It's the tracking system of the laser, and these are very sophisticated. So if you got disoriented and you looked away during the treatment, all that's going to happen is that the tracking system is simply going to stop your treatment until we get you lined back up. So again, it's not all on you. It's the lasers and I that are going to fix this, and you can do this. Now, several days before your procedure, I'm going to call you, and we're going to go over any questions and things, anything that's stressing you out. The day of your procedure, before we even start, I'm going to go over everything you're going to hear and feel and see and experience, and then I talk you through as I fix it. And then I'm going to call you later that evening as well. Almost every patient, when we're finished, they sit up smiling and they'll just talk about how strange and weird the procedure was, but not bad. Now, if you're questioning, do I have to wait for a phone call to talk to you? No. If you, after your evaluation and you want to talk to me, just call me on my cell phone. It's 262-909-5914. That's 262-909-5914. And if you say, well, I don't want to talk to you on the phone, I want to see you face-to-face, can I do that? Sure. You just call our local office number, 262-796-3937, and we'll be happy to arrange a face-to-face meeting. Now, the only thing I ask is make sure you come in for your evaluation first, because if we haven't done the evaluation, I won't be able to answer most of your questions. But once you're done with that, you contact me whenever you want. You'll always have that cell number again after the procedure too if you have questions. Now, I only have one other request, and that is that you take a look at our online reviews. Just go to Lasik Plus Milwaukee and look up on Facebook, on Google, on Yelp. You're going to find a number of patients that were once in the same place you are with the same worries and same anxieties, and they're going to explain from a patient perspective what it was like to be cared for at our center. And I think you'll be really happy that you read them, and I think you're going to be really happy that you selected us as your LASIK provider. So I hope to see you very soon. Welcome to LASIK Plus, and I'm going to take great care of you.